Wellness Wednesday, sponsored by Baptist Health.
Well, as we enter March, Colorectal Cancer Awareness Month, we're shining a light on a startling trend. While overall cancer deaths are dropping, colorectal cancer has now become the #1 cancer killer for men under the age of 50, and #2 for women in that same age group. And joining us now to help us know what to look out for is Dr. Jessica Udeogu, a family medicine physician at Baptist Health. We've just been talking about it off camera because it's something that is on people's minds right now with the loss of actor James Vanderbeek. We also talked about Chadwick Boseman dying from colorectal cancer. So, what are you seeing right now with patients?
Well, we're noticing that younger patients are getting sicker. And that's because of just how life is. Like, we have a more sedentary lifestyle, smoking, alcohol use. It's a multitude of things. It's more lifestyle, and then studies are showing that along with lifestyle, it's due to things that happen earlier in your life, why we're seeing people that are dying earlier and getting diagnosed at an earlier age than we're used to.
Okay, so a lot of people sometimes just brush off symptoms and stuff. So what are some specific red flags for those younger 30 to 40-year-olds?
So if you're having chronic diarrhea, meaning diarrhea over a month, 2 months, going on and on and on, that is not normal. Rectal bleeding or seeing blood in your stool, that's not normal. Consistent abdominal pain is not normal. Other things is like when you're going to the bathroom and your bathroom habits have changed, your stool consistency have changed. Some of those things you need to take a closer look and maybe ask more questions and go to your doctor. Yeah.
But sometimes people don't present symptoms, so that's why screening's so important.
Yeah.
But we were talking about there's a stigma.
Right. So people get nervous about the procedure itself, getting the colonoscopy and having to be put under sedation. It makes them nervous. So if you have no symptoms, no family history, nothing concerning, things that you need to talk to about your doctor so they can make the decision, the screening starts at 45 years old.
Okay.
But if you're having symptoms, having problems, you may need to do it earlier. Yeah.
Okay, and then what's the consistency of how often?
It depends on what's found on the screening and then what screening you do. So if you do the colonoscopy, which is like the gold standard treatment, also while you're doing the colonoscopy, if the doctor sees something concerning, they can immediately take a biopsy. If everything's clear, you don't have polyps, you'll do your screening every 10 years. But if the doctor that does the procedure sees that there's something concerning, they may take that down to 5 years, maybe even 3 years, maybe even yearly for you if you have a lot of polyps and things going on.
Okay, important things to keep in mind. Thank you so much for joining us this morning. And of course, if you want to get in touch with Baptist Health, there's the information right there on your screen.